Welcome to Nebraska Forward. I'm News Channel Nebraska's Mike Flood, and we are here today to try and answer some of the questions that present themselves after a couple months of quarantine for so many of you watching today. I'm joined by the Chancellor of the University of Nebraska Medical Center, Dr. Jeffrey Gould. Dr. Gould has been talking about the need for a national quarantine center, about being prepared for a pandemic and infectious diseases before the coronavirus, COVID-19, hit the United States. And did you ever imagine last year, you might be the only person that could say yes to this, that we'd be in a situation like this as a country, as a nation, on our planet?
You know, it's a great question, because people have been thinking about what a real serious pandemic would look like, and a lot of the preparation that was done for flu, you know, think H1N1 and other concerns, produced some thought along these lines, what the public health people would call tabletop exercises. I mean, what would you do, what would I do, etc. But to think where we were 6 months ago, you know, I'm just thinking going into the holidays, you know, I was with my family and celebrated the holidays together, and to think what has happened since the very first cases of this reported at the end of December, it's hard to believe how much has changed across our nation and across the world.
Nebraska is fortunate to have you and the University of Nebraska Medical Center at the forefront. I think objectively, any way you look at it, we were ground zero for Ebola in the United States, and today led the way on coronavirus. You might know Dr. Gould as the Chancellor of the University of Nebraska Medical Center, or the Chancellor of the University of Nebraska at Omaha, which began in 2017. But I think it's important to note that you had a 25-year career that continues today in pediatric cardiac surgery. That's
true.
A lot of life experiences bring you to this point. Let's talk about where Nebraska is. And, you know, this program today, we're going to talk about something that's on the mind of a lot of Nebraskans, and that is, what are contact sports in the fall going to look like? Will Nebraska have its high school football? Will it have the Nebraska Cornhuskers in Lincoln? Big questions for a lot of families.
Sure.
Before we get there, though, talk about today at Nebraska Medicine. How many patients do you have right now that are in the hospital, and how are they doing?
Well, the good news is that the hospitalization rates across the state of Nebraska have fallen over the last several weeks. We peaked out in late April, early May, and over the same time period since then have come down. And we watch this very carefully. We look at what's going on internationally through the UNMC GCHS, the Global Center for Health Security. We also follow what's going on across the country, and, you know, 50 states, 50 different stories, and we can talk about them, and they're all different. And even if you just look at the medical considerations, some states are rapidly rising, others are rapidly falling, others are plateauing. We have, you know, at least historically, appeared to have had a peak and an inflection point, and are down to a relatively low number of cases. You know, at one time, we had, you know, well north of 25–30% positive tests a day. We're down well under 10% now, and rapidly approaching our benchmark of 5% here in Nebraska. So I would say things are moving in the right direction, but you know, that's a sample in time. That's a moment. You know, that's where we are as of today. And you know, I keep saying to folks, wait a week. We need 21 days of stability before we can even start to think about what the next steps might look like.
How many people are at Nebraska Medicine right now, inpatient, suffering from COVID-19?
It varies. Most recently, I think the census was in the low 60s, most of which, or about half of which, were in an intensive care unit. A significant percentage of those were on a ventilator. That's been our average experience. We've actually seen across the state of Nebraska that for a long time that the ventilator curves and the ICU curves were almost identical, and now we've actually seen them start to shift, in that we are putting more people in the hospital that need to be hospitalized, but fewer percentage of those end up in intensive care. And of those that end up in intensive care, an even smaller percentage end up on a ventilator, which preserves resources, makes these patients, expedites their recovery, lowers risk, and frankly, lowers mortality. And so we've learned a lot about the virus.
You know, at the height of and the peak of the virus in New York City, for example, getting put on a ventilator wasn't a good sign, because at that time I think it was close to 50.
It's never a good sign.
Well,
sir.
right.
I can tell you.
But 50% mortality. What percentage mortality do you have at Nebraska Medicine right now on ventilators?
So, we studied this, and we're very proud of it. In the remdesivir trial, gave us some very good benchmarking on that, and that is in the placebo group, that is to say the patients that did not receive the experimental protocol with remdesivir had about an 11.8 or 12% mortality rate. So, 12 out of 100 would not make it, and most of these were ventilator-dependent patients. And with remdesivir, which is now widely used across the United States, that number has fallen to about 8%. So you think about it, we've gone over time from about 50% down to, well under 15%. Now, it still varies a lot with age and comorbidity, so our older patients with multiple other medical problems, obviously don't do as well as the younger, healthier patients that end up in an intensive care or on a vent. But overall, we've learned a lot more about the virus, better treatment strategies, and hopefully with new drugs, it'll get even better over time.
And when you think about what you just said there, you're talking about inside 90 days, essentially, inside this financial quarter, which is amazing that we've made that much progress. Well, one of the main reasons for this show is to ask some questions, because there are a lot of camps happening or not happening across the state.
Sure.
The top event in any rural community on Friday night is at the football field. The lights are on, the kids from the two towns are playing, and grandmas, grandpas, moms and dads, brothers and sisters are in the stands. Is that going to be possible this year?
So I guess the best answer is I don't know, and I'll tell you why. Because it depends on a number of different factors. I would say the first thing, and probably the most important thing it depends on, is when you're getting ready to go to the stands, what's going on in the local community? That is to say, what's the number of patients getting tested? What's the percentage positive? What's the utilization of hospital beds, ICU beds, and ventilators in that local community? So if the prevalence rate of the disease of COVID-19 is very low in the community, it creates an environment of safety where it's possible to consider doing this. If you have that environment of safety, the second factor is going to be, well, what does it mean to bring the student athletes together? That is to say, when you bring these two teams together and they're in close contact with each other, what's the chance of them cross-infecting each other? And we know that, student athletes, high school students, for instance, are just as easily infected as you and I, but that the impact of that disease is going to be far less, meaning they're much less likely to end up hospitalized or even terribly short of breath, but equally likely to infect you or I or our parents, grandparents, etc. But I think one of the most important determinants about when the lights go on, whether the student athletes participate or not, is the question of what's going to happen with the stands. That is to say, are grandma and grandpa going to come out? And I would say independent of whether the lights are on, whether the students are on the field, independent of whether the directive health measures are in place or not in place, grandma and grandpa and mom and dad are going to have to make the decision as to how much risk that they want to personally take. That is to say, if grandma's got high blood pressure and heart disease, and grandpa's got asthma and has been working on the farm for a long time and has got some lung disease from working on the farm, how much risk are they going to be willing to take until they really know that it's going to be safe? And, certainly we're all feeling, cabin fever, locked in. I haven't hugged my grandchildren since January. I can't wait till I, get that opportunity to do that. But we all want to do it in a way that's safe. And the last thing that I'd ever want to do is think that my parents, or in the case of a high school student, their grandparents, got sick or hospitalized or, heaven forbid, passed away as a direct result of coming to see Junior play ball. So a lot of unknowns. I am guardedly optimistic that we will play ball this fall. I don't know who's going to be in the stands, both who will be allowed to be in the stands, whether they'll have to be 6 feet apart like you and I are right now, or how many people will be willing to sit in the stands. My guess is early going, we're going to see younger, healthier people who are willing to come to the stands. And then over time, as we so-called stuff this virus back in a box, as we like to say in the trade, that we'll see more. And don't forget, we're guardedly optimistic for access to a vaccine sometime late fall, early winter as well. So all of those are factors that are going to have to go into these determinations.
Well, you mentioned a vaccine. Light speed in terms of getting to a vaccine, probably more than we've ever seen in the history of the world or this country. If a vaccine is developed and it is approved, that's one thing. It's another thing to deliver this to all of the people
Sure.
in the country. How does that even start? Let's say the vaccine's done by December 1st.
Yep.
What would be
Which would be a really best case scenario if that really happens, because you think about it, there are there are 141 vaccines under development in the United States right now, of which there are 10 in phase 1, 8 in phase 2, and 2 in phase 3. So phase 1 and phase 2 are safety testing. Phase 1 is for healthy volunteers, you
Sure.
and I. Phase 2 is older, younger people who aren't quite so healthy, but it's also a limited safety test. And phase 3 is efficacy testing, which typically requires thousands, sometimes tens of thousands of individuals to get done. So, but let's go back to your scenario. Let's say we do have a vaccine that is thought to be safe and, again, thought to be effective. In order to get herd immunity, which is what it's going to take to make going to the stand safe, we probably have to vaccinate, given what we know about COVID-19, somewhere between 55 and 70% of the population. They either have to have had the disease and have antibodies to it, or you have to vaccinate them. So you think about that in the state of Nebraska, what is it going to take? There are, roughly, 2 million people in the state. Let's just use that for routine numbers, and let's say it's 60%. We'd have to immunize 1.8 million folks. Or think about Norfolk football. How many people in the stadium, how many you'd have to immunize, and by the way, know for a fact that the vaccine is sustainable and effective for a period of time. So our federal colleagues, and indeed our public health organizations, have actually worked out protocols for who gets immunized first, how the vaccine gets distributed. I'm going to guess the National Guard's going to have to be involved, just like it is now for testing, here in Nebraska and widely across the country. And then protocols for immunizing the most vulnerable, high-risk people first, because that's where you're going to really prevent the hospitalizations and the mortality. The tragedy of this, or maybe not the tragedy, but the irony of it, is that the older populations tend to become less immunized. That is to say, just as the story with flu vaccine, the younger you are, the less likely you are to get hospitalized, the more likely you are to have an effective response to a vaccine. The older you are, the more you need it, the harder it is actually to get immunized. And so over time, what's probably going to happen is you're going to see different types of vaccines for the older geriatric population, a different set of vaccines for the young, and then even you get a third set for the middle-aged folks who are immunologically
Sure.
very capable but not at high risk.
We're visiting with Dr. Jeff Gould, who is the Chancellor at the University of Nebraska Medical Center and the Chancellor at the University of Nebraska at Omaha. Also himself a physician with 25 years as a pediatric cardiac surgeon. He finds himself in the middle, not only of the country, but of the conversation about what we should be doing with the quarantine. We have obviously a quarantine center at Nebraska Medicine. We don't have a lot of time here, but in our next segment, we're going to talk to folks in high school athletics administration and the Big Ten as we look
Cool.
at that. Of all the questions you get, how many times do you get asked about Nebraska football?
All the time. But they're probably tired of asking me that question because I keep answering it the same way and say we really don't know. I mean, I can tell you though that the university is and Husker Athletics are doing everything they can to try to make this possible. And we're going to talk a little bit later to Dr. Chris Cradaville, who's been very involved with the Big Ten, and all the Power 5 conferences are working very hard on trying to create a plan. But safety is the North Star. If we can't do this safely, we're not going to do it, because if folks start getting sick, student athletes or trainers or coaches or
It all spirals.
It all spirals, right.
He's right. When we come back, we're going to talk to Dr. Chris Cradaville, who is at the University of Nebraska Medical Center and has been appointed to lead academics across the Big Ten to decide what's next for not just Big Ten universities, but student athletes and fans. We'll be right back. You're watching Nebraska Forward on News Channel Nebraska. Back to Nebraska Forward. I am your host, Mike Flood, with News Channel Nebraska. We have Dr. Jeff Gould, who is the Chancellor of the University of Nebraska Medical Center and UNO in Omaha. And we're very fortunate right now to have Dr. Chris Cradaville. He is at the University of Nebraska Medical Center, a Vice Chancellor for Clinical Research and Professor of Psychiatry and Pediatrics. Dr. Cradaville, welcome to the show. Dr. Gould tells me that you two work often during the day and talk several times. So this is just another part of your day where you're on television now with Dr. Gould. Welcome to the show.
Thank you, Mike. Appreciate the opportunity to be here.
So, Dr. Cradaville, in addition to your work at the University of Nebraska Medical Center, you've been appointed now the lead of this new Big Ten task force for emerging infectious diseases, charged with advising Big Ten universities, not just on the academic side as to how to take care of students, but student athletes and notably football teams and basketball teams and all of the different things that student athletes do. As the leader of that group, which I should add, and Dr. Gould knows the pedigree of everybody else here, these are highly respected doctors from medical centers across the Big Ten. Pretty impressive list.
Yep.
The first question I have is, when you look at your work here, is your group looking to be uniform, or is it to allow individual universities to make decisions and interact with each other in some way that is cohesive? What is the mission?
Yeah, that's a great question. So this task force was created by Kevin Warren, the commissioner of the Big Ten, all the way back March 7th, so very early in the pandemic. And his vision was to bring together representation across 11 states, spanning Nebraska to New Jersey, all 14 universities having representatives on this committee, being able to really leverage the expertise throughout their academic settings and bring this information together to provide considerations for the Big Ten, looking at health, safety, welfare of the players, the coaches, the officials, and to really help provide considerations for the Big Ten in moving forward. So the idea is to put all these together in a format that can help inform decision making both at the university level but also at the Big Ten level. So we work very closely with Commissioner Warren as well as his entire staff.
Dr. Cradaville, obviously part of a very big effort on the Big Ten Task Force for Emerging Infectious Diseases. Dr. Gould, what does it mean for the University of Nebraska? We've been in the Big Ten now for 10 years. To be the leader of an emerging task force like this on a topic that is at the top of everyone's list everywhere.
Well, it's certainly a great privilege and pleasure and honor for the Global Center for Health Security and for UNMC and to have Dr. Cradaville in this position. But it's also just an incredible responsibility for us. I was recently meeting with one of the leaders in Washington, D.C., one of the secretaries of a critically important agency, and I'll never forget that I walked out of the room and the gentleman said to me, Jeff, if you guys can't get this right, no one is going to get it right. And that is a great honor to be respected that much, but it's also a tremendous responsibility for us. And I'm so pleased because Chris Cradaville and the team at the Global Center and the amazing individuals on the task force that have been set up, they're focused on the safety and health of of student athletes, as he says, of the coaches and trainers, and of course, when appropriate, the fans.
So, Dr. Cradaville, one of the questions I'm sure that you wrestle with, and I'm interested to know how you weigh this out, but there are a lot of Nebraskans, there are a lot of people in all these other states, business owners that are tied to sporting events. Will the Huskers play in Lincoln? How do you weigh the economic impact and considerations of not having Husker football or Iowa football or Michigan football with all of the health concerns? How do you assess the appropriate weight to concerns like that?
Yeah, that's really a great question. And first of all of us on the committee are big sports fans, so that certainly helps motivate us to do what's right. But in our charge, really doing what's right is focusing on the health and safety of the players, the officials, the fans. And so at this point, really we aren't being asked to take into consideration the economic impacts. That's really being left up to the chancellors, to the university leaderships, as well as the Big Ten. What they would like us to do is really give them information on what are the risks, what are ways that we can identify ways to mitigate those risks. So really our goal is to help make them make the most informed decision that they can.
Well, that is a big burden because so Dr. Gould, the decisions and the task force makes some recommendations to the leadership of each university, and then you're in that role as a chancellor, and certainly President Ted Carter makes a decision. How does all that weigh out if you had to predict not only at Nebraska but among other Big Ten universities? How do they weigh those economic considerations?
So the economic considerations are large. I mean, there is no question about that, particularly in the Power Five conferences such as the Big Ten. However, in my limited way of thinking of it, understand, you're talking to a dumb heart surgeon here who doesn't really understand this stuff as well. But if we can't provide a safe environment for our players, and if we can't provide a safe environment for the fans, whether they're in the stadium, outside of the stadium, or at home, whatever that combination may be, this is going to be a self-limited process, and it's going to be a spiral, and it's going to be going downhill. So we have to be able to bring these individuals back, bring college sports back, and professional sports for that matter, but do it in a metered way so that we know where we are in every step along the path, and then each step this leads to the next step. And that's why having a group of leaders such as Chris Cradaville in place is going to be incredibly important. And I do get asked, are there going to be fans in the seats? And I'm guardedly optimistic, as I said. That's a good medical term to sort of hedge your bets a little bit. But I am quite optimistic that there will be. But I don't think it's all going to happen on one day. I think there are going to be a number of steps, and each step will be measured and then gone to the next step.
Dr. Cradaville, as you lead this effort among Big Ten universities, things change so fast, not just with the science around the virus, but the politics and the feelings of the nation. Should we wear a mask or not wear a mask? And I think we all know the answer to that is whenever you can, you should be wearing a mask. How do you plan for the future and deal with the hour-by-hour, day-by-day changes? Is it something where you meet almost daily as a task force, or do you meet weekly, monthly? How does it work?
Yeah, so that's a great question. You're right, it is a very rapidly evolving situation. So we meet at least once a week with our entire committee, all 14 universities, along with Commissioner Warren and a broad swath of his Big Ten staff. In addition to that, we have frequent meetings with athletic directors, with the chancellors, with coaches, with players' representatives, even with groups of officials, so we can convey to them what we're doing, what we're thinking, but also get feedback from them. And then, as you can imagine, we're very rapidly interacting with emails and attachments, and we're weighing information not only from the NCAA, but also bringing information from professional sports, from the CDC, from what we're doing at our academic health centers, research on testing and new treatments and ways to improve personal protective equipment. So you're absolutely right. There's a lot of information. It's moving quickly. It means we need to meet frequently, have a lot of interactions to stay as best informed as we can.
A lot of schools are basically saying you're not going to come back after the Thanksgiving holiday. How much of your work, Dr. Cradaville, and you, Dr. Gould, is centered around this idea a lot of Nebraskans have, predicting when the second wave will hit? And I know that by saying that, there's a problem even with calling it a second wave. We may not be out of the first.
We're not out of the first, but go ahead.
Dr. Cradaville, how much of that takes up your time with this idea that a lot of folks have about predicting when the second wave will hit?
I would say we're doing much less work in predicting and much more work in focusing on what can we do in the here and now. So we are very actively engaged, and I think one of the strengths of this task force that we have is we are leveraging the experts that are working in healthcare, that are working in public health, that are working in training education. So we're taking the folks that are really helping address what's going on in the here and now to inform what we're recommending be considered for athletics. So really we're focused on what can we do now to mitigate the risk, to really squash down the virus as best we can. And I think one of the analogies I've heard that I really like is the hammer and the dance. And right now we're in the hammer phase. We're trying to squash it as much as we can. And then the dance is later on, as these little flare-ups come up, how can we quickly address that and continue to mitigate risk moving forward?
Dr. Gould, as the leader of 2 campuses yourself, there's a lot of folks in Nebraska that feel like things are getting back to normal because they can eat in a restaurant or they can go places, they see more people out. What would you tell them about the resurgence or the second wave? That's obviously something that's a lot more complicated than just saying, oh, it'll be here at Thanksgiving.
Well, there are so many different models out there as to when and if a second wave occurs, how severe it will or won't be. You know, I'm right with Dr. Cradaville. Let's get out of this phase. I mean, and frankly, as we sit here today, I don't know whether we're in the 9th inning, the 5th inning, or the 2nd inning of this phase. You know, we're seeing, 20 states across the country seeing significant upticks now. Some of that is more testing, but the percent of positive tests and the hospitalizations are actually going up in some of these states as well. Now, we're very fortunate in Nebraska. We work very, very closely and monitor the statistics almost hourly, but certainly once a day there's a conference call with hundreds of people, including the governor, where we talk through every single statistic from every single public health district in the state, go over testing results and things of that nature. So the idea is to make graded step-by-step decisions, but keep our eyes wide open. And I think being flexible and being willing to say, you know, as long as we meet certain thresholds, we can continue to progress. Now, I will say, you know, just the other night, I was in the local grocery store, and I was one of the very few people wearing a mask, and that does concern me because there is still plenty of virus in this community, you know, particularly here in Douglas County. I mean, there's quite a bit, and we haven't quite gotten to the stage, as Dr. Cradaville says, that we've squashed it down.
Dr. Chris Cradaville, thank you so much. He has a big job on behalf of the University of Nebraska system with the Big Ten. And Dr. Jeff Gould, who will stay on this show as we get ready to talk to the guy in charge of all high school athletics in Nebraska. He's got a lot on his plate as we answer questions like, will there be football in the fall? We'll do that next on Nebraska Forward. You're watching News Channel Nebraska. Welcome back to Nebraska Forward. I'm News Channel Nebraska's Mike Flood, joined by Dr. Jeff Gould, Chancellor of both the University of Nebraska Medical Center and the University of Nebraska at Omaha. And we are doing our best with this brand new program to answer questions you may have as we go forward from this virus, still understanding that it's very much still, you know, obviously if you watch the news there, a major concern across the state, to say it lightly. One of the things that we want to do is want to answer your questions. You've got one of the top experts in the nation here from one of the universities that's getting the most attention for solving problems like this. You've got a chance to ask him questions. So if you're watching us right now on Facebook, if you're watching this live stream on your computer, get to your social media account and ask those questions. If you put your question on there, we're going to get to a segment here in about 10 minutes where we'll do our best to answer those questions for you and get you the answers right here live as this program progresses. Right now we want to welcome a guest. This guy has had a tough year from canceling a basketball tournament for fans midway through the state boys basketball tournament, to deciding whether or not high schools will play. Together with his board, we have the Nebraska State Activities Association Executive Director Jay Beller, who joins us here, former superintendent at Battle Creek Public Schools. He's into, what is this, year 2 of your job, Jay? You have to be thinking, what did I sign up for in the middle of this pandemic? How are you doing?
Yeah, Mike, I'm doing fine, and you're right. I've been asked many times if I wished I were back at Battle Creek, and I thoroughly enjoy the job, but it's been a tough 3 or 4 months, that's for sure.
Let's just set the stage. This year, the state boys basketball tournament gets ready to start on a Thursday, and that Wednesday, essentially the mayor of Lincoln makes an announcement that due to the pandemic, there can't be any gatherings very large and certainly can't hold a basketball tournament. You probably, of any organization in the state, felt the effects of COVID before anybody else. What was that like to go through that with you, your board, the coaches, the players? What was that moment like?
Yeah, that was awfully tough at that point in time, because really we didn't have a clue what that was, and sometimes we're still thinking that at this point in time. But yeah, immediate family, they told us only, and so we had to determine what immediate family was. The social distancing we have never heard of before, really, so we tried to take that in mind, and they were talking about how they would trace this, and it was all foreign to us. So we did the best we could. Schools worked well with us to make that tournament happen. We had a lot of help from our NETV and News Channel Nebraska, that we could bring it to the fans that couldn't be there, because they were really disappointed that it couldn't go on.
So the first question that Dr. Gould and I were talking about at the start of this show is, what will the fall look like? And I guess the question for you is, what are you hearing from the athletic directors and the activities directors across the state? What are they telling you that they think should happen in the fall before we get to any potential outcomes?
Well, I think that they're really hoping that we get to see football and volleyball and all our activities in some way, shape, or form. I don't know at this point in time if they're really concerned about what the stands will look like, although they are, from the fact that our high school are not a lot different than our colleges. Our high school budgets in football help pay for a lot of other things, and so they're hoping that they can bring people in. I think the kids are chomping at the bit, that they want to get out there, they want to do something, and you know how kids are, it's never going to happen to them, so they're ready to go.
Question for both of you. Dr. Gould is here from the University of Nebraska Medical Center. Let's take Dawes County in the Nebraska Panhandle, 1 confirmed COVID case.
Right.
And let's drop down and take Dawson County, where Lexington is. Schools of similar size, obviously hundreds of cases, over 1,000 cases. So you've got those 2 schools that are set to face off. Dr. Gould, from a health perspective, you hear about that game and those 2 crowds.
Sure.
That's different than maybe Shadron taking on Valentine, where the number of cases in Cherry County aren't very high. What would you tell the athletic directors of those 2 schools if something like that presented itself?
I think that if they're being careful with the health of the students, that is to say they have good access to testing and contact tracing, and that if at the moment of the competition, whichever city or town it happens to be played in, if there's reasonable control of the number of cases, then go ahead and play the game. You may want to think twice, depending upon, so for instance, in one community, you may want to have more social distancing and spread out in the stands than you might want to have in the other community. But I'm going to guess, the phrase that we use a lot and that I've come to repeat very often is in an abundance of caution.
Yeah.
When we're talking about the lives, hospitalization, literally a disease that's got 10 times the mortality of influenza, we have to be cautious. And so you don't want to do things that would risk hospitalization and bad outcomes in our student athletes and the coaches, trainers, the officials, and we certainly don't want to risk it in their families. But I don't think it's a matter, Mike, of how many cases they had over the last several months. It's a question of what's the prevalence on a given day. And if the prevalence on a given day is low, then I'd say go ahead and play.
Jay Beller joins us now. He's the executive director of the Nebraska State Education Association, managing all of the activities that happen at these schools. Have you heard from different athletic directors across the state? So, for instance, the Chadron and the Lexington, the Grand Island and the Lincoln, different situations in each town. Do you notice a difference in the way that administrators are looking at safety just by virtue of where they live and where they're located?
Yeah, I think we sure do. And that last question, I was glad to hear that answer, because we're getting asked that a lot too. Is we're a state organization, but it sounds like that we're going to be governed in a lot of this by our local health departments. And if we're playing somebody halfway across the state, what health department is going to give a direction to those schools, and they're going to really have to communicate together, and of course we will help sit in on those things too. But we're going to listen to our local health departments and our government officials and what we can do, because you're exactly right, Mike. When I hear from the people out west that it's not prevalent in their areas, they're ready to play, and they want to know if, maybe can we change our schedules and just play people in our area. And the schedules have already been set, so that's going to be hard to do, but we're really going to have to look and see what we can do for everybody.
You're listening to Jay Beller, who's the executive director of the Nebraska State Activities Association. Dr. Gould with the University of Nebraska Medical Center. We don't have much time, but as you heard Jay Beller talk about, there's this coordination between health departments.
Sure.
Talk about what that is and how it should work and what should guide them. I think you've talked about some of the benchmarks, but there really is a merging of two different agencies when that happens, because it's two different towns.
Well, absolutely, and they work extremely well together. They meet on very frequent intervals. They share data. They have the same definitions of what is a case or what is a COVID-related hospitalization, or for that matter, even what is a COVID-related death. You may think that people don't have to debate that, but there actually are standard definitions for all of that. And when these folks work together, that's going to, make it useful. So, I mean, just to put it back into the frame of Husker athletics, I mean, think about Rutgers, New Jersey versus Lincoln, Nebraska. I mean, not only are they half a country apart, but look at the prevalence of cases in New Jersey, New York, and Massachusetts, and Maryland, just within the Big Ten Conference alone, let alone the interconference play that's going to happen. Those are far more extreme differences in policies and health directives, and requiring the local public health departments to really get together and have a meeting of the minds as to what one venue is going to require as compared to the other, and to be able to make it safe.
Big questions for administrators, big questions for the Nebraska State Activities Association. Thank you very much, Jay Beller. We're going to take your questions next. Get on Facebook, News Channel Nebraska, and let us know what question you'd want answered, and do it right now. We'll be back with some answers to your questions right after this. You're watching News Channel Nebraska. Welcome back to Nebraska Forward. I am Mike Flood, your host here on News Channel Nebraska, joined by Dr. Jeff Gould, Chancellor of both UNO and UNMC. And now it's your turn. Send us your questions to Facebook. You get them on there, we'll get them answered the best we can, provided we have answers. We're going to...
We the people are guaranteed.
Here we go with our first question from Jim O'Gorman. How accurate is the antibody testing? When will it become more available to the general public? Dr. Gould.
Sure. So antibody testing is a way of measuring immunity to the virus. That is to say, if I'm exposed to the virus and I have antibodies, just like measles and pertussis and all of these other immunizations, we won't get, or we'll either get it or mildly, or we won't get it at all. So there are dozens of so-called serologic antibody tests. Some of them test specifically for COVID-19. Some of them test in general for one of the coronaviruses. And there's a very variable amount of accuracy. So we have looked at the Med Center, about a dozen of these different tests that are available on the market. And they vary from about 70% accurate to about 97.5% accurate. And so they are available today. They're available, I think, in almost every state. And and there are reference labs that are capable of doing the test. But it is important when an individual is antibody tested, and understand that we only develop antibodies after we get infected, so it's not a very good measurement of are you infected today. That's where the PCR testing comes in. But the antibody tests are what is your chance of getting it again? And truthfully, we don't know how long the antibodies last, and we don't know how effective they're going to be. Meaning, if I have antibodies, does that mean I can't get the infection for a month, 6 months, a year? And if I get it, am I going to get it more mildly? So a lot of research needs to be done. But in answer to that specific question, those tests are available today.
A lot of unanswered questions because there's not a lot of answers as we're in.
Well, this is a whole, think about this. Before, the New Year's Day, December 31st of last year, no one even knew that this really existed.
Right.
Let alone all of the bizarre functions of this virus. I mean, and it does not act like almost any other viral infection that we've seen. It's, there are some parts of it that act like flu, there are some parts of it that act like Ebola, there are some parts of it that act like SARS or MERS or other coronaviruses. But it has unique characteristics that make all of these questions a bit uncertain. And, as a scientist, deep down in my soul, I try pretty hard to answer questions based on the science and not based on anecdotal experience.
We have our second question here on Nebraska Forward with Dr. Gould. From Liz, how would you grade the job local health departments have done communicating with the public?
Yeah, so Liz, the local health departments, and I take it you're talking about the local health departments in Nebraska, are doing a great job. We get to work every day. Literally, we have a 9 o'clock conference call with the leadership of all the local health departments. And they are so knowledgeable. They are right on top of not only the data for their local public health district, but they ask phenomenal questions, and they try to be preemptive. This hospital needs more personal protective equipment, and this hospital, when are we going to get some additional doses of remdesivir or some other treatment? And so the ability to communicate in a timely, accurate fashion is key. And my take on it, Liz, is that they're doing a really good job with the information they have. But just like the last question, we talked about with antibiotics, if the best answer is I don't know, I think it's better to say I don't know and I'll try to find out than it is to share information that may or may not be accurate. Because one of the things that we desperately need at this time is a source of good, accurate, reliable information. And that's where the public health districts come in.
We're to the very end of our show. We're with Dr. Jeff Gould, Chancellor at UNMC, UNO. I have the last question, and it is this. What behind the scenes have you seen that has inspired you? We've talked about all the negatives. We talked about the effects of coronavirus, but you have a very unique perspective. With a minute left, what would you identify as something that's inspired you that maybe the rest of us would never know about?
So that's easy. I am inspired by the frontline healthcare workers that are dealing with patients that are infected with this disease on a day in and day out basis. Understand there is no cure or treatment for this disease, and yet these women and men come to work every day to take care of other people so they can go home with their families and go back to their society. And that is absolutely inspiring.
And there are a lot of them that are probably pretty tired right now.
And there are over 500 of them in our nation that are no longer with us as a direct result of being exposed to this virus. So they have made the ultimate sacrifice to care for other people.
You're watching Nebraska Forward on News Channel Nebraska. We want to thank Dr. Gould. We want to thank Jay Beller and Dr. Cradaville. We hope you enjoy this program. It airs live every Tuesday at 3 p.m. Central, and it will be replayed Wednesdays at 7 p.m. Central. With Dr. Jeff Gould, I'm Mike Flood. You're watching News Channel Nebraska.